The health minister yesterday said the new wave of COVID-19 this time will be longer than usual as cases gradually increase. At the same time, other contagious respiratory diseases such as influenza and respiratory syncytial virus are also on the rise. Dr. Ashok Philip, consultant physician from Mahkota Medical Centre, gives us an overview of current outbreaks from these viruses and what to look out for.
The thing is that COVID has changed so much from the time when we first came into contact with it. It was basically cough, running nose, loss of smell, loss of taste, that sort of thing. But now, a lot of people present with COVID with diarrhea and much less upper respiratory symptoms. Influenza, we consider upper respiratory infection, but often it presents with severe high fever, body aches, as well as the running nose and cough. So if you've got a lot of fever and body aches, it's more likely to be influenza. If you present with a bit of cough, fever, and then you're getting diarrhea as well, then you should be considering that you might be having COVID, especially if you've already had your booster and all that. And a lot of people present with diarrhea instead of the classical upper respiratory symptoms. RSV in adults, it usually presents as a very mild upper respiratory infection, cough, running nose. It's more serious in very young children, like 1 or 2 years old, or in very elderly adults. But most adults and children above 1 to 2 years old have minimal symptoms, and it's not dangerous as such.
Dr. Ashok said the outbreak of these viruses are not unusual, especially during the transition to the endemicity phase.
Viruses are always around, but when we had the lockdowns for COVID, it also interrupted the transmission of RSV and influenza. I hardly saw a single case of influenza in the 2 years when we were locked down, because they all depend on close proximity for transmission as well. If you're not close proximity to someone who's got the illness, then it won't transmit. Influenza went from thousands of cases a year to almost none. So now that we've opened up, the lockdown is over, people are moving around, people are going to shopping centers, going to movies, having parties, traveling. So it's ripe for influenza to spread. Every year we do have outbreaks of influenza, but in this climate and in this country, it's not usually very serious, so we don't pay much attention. But there are thousands of cases. It's just, I think now we are a bit sensitive to it. Every time you've got a running nose, you rush to your doctor and say, have I got COVID? And the doctor will just check you for influenza as well. So suddenly you found out you got influenza. Whereas 3 years ago, you wouldn't bother. You wouldn't go and test. You wouldn't know you had influenza.
So how can we protect ourselves from these contagious respiratory infections? Dr. Ashok said continuing to maintain our hygiene and masking up in crowded places, just as we did during the onset of COVID-19, would be the best prevention.
What can we do? Because that is basically the most effective thing, what we do. And what we can do is to continue what we've been doing for the last couple of years. We were so familiar with it now. Sanitize your hands all the time. Because though we call it a respiratory illness, it's not often transmitted by people coughing and sneezing alone. It is more when you touch an infected surface. Somebody who's got the infection has touched a table, and then you touch the table, or you touch the door handle, and then you touch your nose or your eyes, and you transmit it. So sanitize your hands. And if you are in crowded public places, please continue to wear a good mask. And that will help to cut down the great majority of infections. As far as what the authorities, the government can do, what they can do is basically to reinforce these messages. Tell them we're not out of the woods. These diseases are still there. And though they may not be dangerous for the great majority of us, we also have to take care of those people who are more vulnerable because of their age, because of other illnesses they have, or people who cannot take the vaccines because of allergies. They are vulnerable, and we have to take care of them. So the function of the government here is to tell us, reinforce these messages that we have to take care of ourselves, and we have to take care of others as well.